Hi everyone, I'm Dr. Denitsa Blagev and I'm here at the American Thoracic Society meeting in San Diego with Dr. Valerie Press from the University of Chicago. We were excited to present our work this week about the LIV score that risk stratifies COPD patients, and I wanted to ask you, how do you see that you guys could use that kind of score at the University of Chicago?
Sure, thank you for the opportunity to talk about this exciting project. So I'm the Executive Medical Director of Specialty Value-Based Care at the University of Chicago, based largely on my original work working with COPD and our value-based care through a bundled payment care initiative. And I see this kind of score as being very useful because, as you know, we have many patients that come into the hospital with COPD, but some are at higher risk than others for readmission or more costly care or more post-care needs. And so what I think this score could do would be to help us triage some of the highest risk patients to receive some of the more costly resources that we wouldn't be able to give to absolutely every single patient that comes into the hospital.
And is this the kind of thing that your patients would need to know about, or is this the kind of thing that kind of the frontline providers would be interested in?
Yeah, I think you can think about which stakeholders would like this information the most. I think that frontline providers and even our administrators would use this data from a population level to help identify cohorts of patients that are at risk, and then our providers to figure out who to triage which resources to. I'm always a big fan of involving patients and having very transparent information, so there are possibly ways where this score could help with patient engagement such that they would be more interested in being involved with their own care, or they would be interested in some of the resources that we were providing them.
Well, thank you very much for joining us.